Hi everyone, it's Dr. Vanessa here, and today's talk is on integrative body psychotherapy, IBP for short, and I'll keep on saying the full word so it sinks in. But first, a couple of announcements. So, Brio Bingo or Brigo is still happening. I've made some more progress since I last threw the game board up on Facebook Live, and there's only 2.5 weeks left to play and post on hashtag Brio Bingo. Again, there's great prizes to be won, so don't miss out on this. The odds of you winning are currently looking pretty high, but we are expecting an influx of last minute activity as always. So get your entries in before the deadline, and that is end of day Father's Day, Sunday, June 21st. Another note is that our own Dr. Jeff Lee will be giving a special webinar in less than 2 weeks about creating stress resilience. This info will be relevant to busy and stressed parents who, in my mind, work hard and play hard, especially entrepreneurial moms. So keep an eye out for that information on the webinar and also for the accompanying live online course coming soon. Okay, IBP, Integrative Body Psychotherapy. I've tried talking about this topic many times before, and I'm still trying to figure out the best way to convey my passion and appreciation for this work. Firstly, the name itself, it's a mouthful. Integrative Body Psychotherapy. What? Huh? I know. So I want to break it down. And so integrative, in that IBP treats the whole person. This is also a key principle of naturopathic medicine. It integrates the following components. So we have the body, which is physical health, the mind, mental health, emotions, emotional health, and it's all encompassed by the spirit, which is everything that you are. There's other triangles that you may have seen before in CBT, or cognitive behavioral therapy. This one here is the cognitive triangle, and it's something similar. It's about the how thoughts, feelings, and behaviors work together. So that's the integrative part, the healing triangle that I just showed you. This is a tool that we were taught in naturopathic medical school, and the analogy was always given like a loose string or thread of a sweater. If one element of a person's being is out of balance or causing a lot of distress, it's going to throw off the rest of the system. So it was always asked, where is the seat of the person's health right now? So if you're experiencing a lot of physical pain, that's going to definitely influence your thoughts and feelings as well. And the body and psychotherapy elements of integrative body psychotherapy emphasizes the mind-body connection. So IBP is a type of mind-body medicine. Many other types of therapy are considered incomplete because they focus on just one aspect of that triangle that I just had up. Usually, with a lot of talk therapies, just the mind. And then with somatic therapies, working on the body, but without considering the thoughts attached to the feelings. So whenever there's an imbalance, or you're not treating the whole picture, the whole person, um, you're not really going to get a cure because you're not acknowledging all parts of the person's being. As I mentioned earlier, imbalances and points of pain in one area can cause disruptions and compensations in their surroundings and other aspects of our health. It's also integrative because it integrates many critical approaches to mental health and human evolution, including psychoanalysis, so that's the work of Freud and Jung, people like that, object relation therapy, Gestalt therapy, Reichian therapy, self psychology, bioenergetics, Feldenkrais therapy, transpersonal therapy, as well as Eastern philosophies and practices, such as Kundalini yoga. There's a much longer list, but I don't want you to worry about the names or even knowing what these things are. And good for you if you do have a semi-solid or even firm understanding of the things that I mentioned. I remember feeling quite self-conscious in my university days, especially in my philosophy and art history classes. I would never want to mispronounce the names and titles of influential figures and pieces. Luckily, I'm past that now, and who knows, I might have even said those things slightly off kilter, but I'm okay with it. So the main takeaway from that list is that by drawing on all these different but complementary methodologies, IBP can feel comfortably familiar, but produce completely different results at the same time. Combining these things can offer a powerful and even transformative experience for those who are lucky enough to experience it, including myself. So IBP is officially recognized as a somatic or body-based psychotherapy. So there's again that mind-body acknowledgement in Canada and also Switzerland. These are countries which require therapeutic modalities to be approved and certified by government and professional bodies. Yay! That's a good thing, right? Because they're aiming to protect the public by establishing that there's certain quality and legitimacy. So, although you may have never heard of it, IBP is a legitimate form of somatic-based psychotherapy. And it's actually used throughout parts of Europe. I've already mentioned Switzerland, but there's also an institute in Italy, as well as across Canada, coast to coast, and the United States, where it was founded actually in California by Jack Rosenberg. I feel IBP is profound in its simplicity and non-invasive approach. It often starts with a detailed discussion of one's family tree and the relationships between husbands and wives, parents and their children, siblings, defining traits and hopes and dreams of individual family members, what they wanted and didn't get, and larger themes that transcend generations, as well as earthquake events. These are things that upend the established order and beliefs of how things are done in one's family of origin. Then follows a discussion of one's primary romantic relationships, if applicable, and how the patterns in the family are often projected into the partners we choose. So using energetic breath work, and you can watch a video I did earlier on breathing techniques for relaxation and energy for examples, and more importantly, to try it for yourself. I really encourage that. The breath work brings about aliveness in the body. When we're talking about such heady stuff, such as the family history and someone's health history, a lot is said by the body, or even when you're bringing up certain issues, there's often a sensation that's tied to it that isn't spoken or isn't acknowledged. But in IBP, we absolutely encourage that. So to bring a feeling of aliveness, that really sounds nice, doesn't it? Because we all know how to live, or rather survive, but I feel many of us aren't aware that we're not fully alive inside. That is, until we break through the energetic blockages and muscular holding patterns that we've accumulated in our body since childhood, and perhaps even earlier in utero, in response to environmental conditions, slights, challenges, etc. So these maladaptive patterns, they stunt our personal growth and development. But the issue is that most of us aren't even aware that they're there. So we need to start with the awareness, of course. Many of us additionally carry around self-limiting beliefs. And these are really deep in our core. They can be things like, I'm not good enough, or I don't deserve happiness, health, love. There's unlimited versions. Maybe you know your own personal fault or assumed fault. And I am really here to tell you that these are often, they're not real. These constructs about who we are, they're actually delusions. These limiting thoughts often seeded themselves when we were just babies, quite helpless, reliant on our caregivers to provide safety and comfort. And when they didn't respond to our needs, when we were crying, and the patience of a baby is just so small, when we're in pain and we can't do anything for ourselves about it, we reach out. And for whatever reason, parents might not be immediately available. And then the infant often, takes that in as, there's something wrong with me, that I don't deserve help, or, I'm just alone in the world to deal with my problems. And the real story is that as we grow up, we're no longer those helpless babies, but oftentimes those feelings of inadequacy that have been stored in our bodies are still there. And when situations arise in adulthood that trigger those beliefs, and they're often not immediately relatable, but we frame them as a small child would, that doesn't really have a full understanding of how the world works, and aren't able to help ourselves out of that situation the way we actually can as fully functioning adults. So breathing allows the body to shift into a parasympathetic state. This is one of rest and digest, peacefulness, I like to think. and out of our chronic sympathetic dominant state. These are the 5 F's that you should give a about. So fight, flight, freeze. Every day I watch pigeons and crows out there doing their thing, in response to loud noises, one another, maybe me making cooing noises. So when they feel afraid and threatened, it's a part of their instinct and ours to exhibit fearful responses. So that's another F. Fight, flight, freeze, fear, and then the last F is fragment. Fragmenting is the opposite of integrating. Having an integrated parasympathetic state where things are flowing smoothly throughout our body. When we don't have this smooth flow, internal chaos often spills over into our daily lives and interactions. So before I mentioned how the self-limiting beliefs affect our personal growth and development, but something that people might be more concerned with is outward appearances and professional growth and development. So when we don't take care of these, of our core selves and get a grasp on these self-limiting beliefs, they can cause disruptions in the present time. And when they bubble up, the goal really is to contain them and not let them drive all our thoughts, feelings, and behaviors, and go back to those patterns that we just run when we're in a fear and stress state. And how we can do this is by breathing and connecting with our bodies and processing it there, not just in our heads. So have you ever repeated a mistake or said something you know you will regret later in a moment of panic? I certainly have. And so that is this personal conditioned response that we have been playing on repeat in response to a much earlier situation that happened in our childhoods often. And it's not relevant anymore, but because we never dealt with it, with that original injury, we try to over and over resolve that conflict with the present scenarios that we're dealing with. And that's impossible. It's not successful. We need to go back in the past and trace it back to its root. So awareness or mindfulness all starts with awareness of sensations in and around the body, as well as awareness of the breath. We all do more than enough thinking, and we really need to shift our energy towards feeling. In fact, the constant thinking, busy brain, monkey mind, distracts from our ability to sense our real feelings, including a sense of well-being. So many today struggle with anxiety, sleep disorders, and one of the easiest ways to quiet our minds is to focus our attention inward, not on our thoughts, but what we're really feeling inside our bodies and where. So to do a body scan and just check in with yourself. Where is there more warmth or coolness, any tightness, just whatever you can think of. Some people feel in colors, in very subtle movements and sounds even, but just removing, not removing, because we want to be integrated, mind and body, but just not focusing on what's above the neck, but paying attention to what the rest of our body is doing, that often we drag around by overly using our heads. So the idea seems simple enough, but most of us are habitually cut off and split off. We rarely can do the work of creating an integrated experience of ourselves, um, and especially in our interactions with others and the world. The goal of IBP is to really help patients sustain a constant integrated mind-body awareness of their core self, and take care of their own needs in the face of ever-changing circumstances that the world throws at us and the inevitable interruptions that we face from the moment that we wake up. So successful therapy requires an integrative approach, such as IBP. And the breath is the portal to enhance self-awareness and mindfulness. And we should all question our beliefs about ourselves, those foundational core beliefs that we tell ourselves that limit, our potential and shape our view of the world, and also acknowledge how those things influence our thoughts, our feelings, and behaviors. By giving patients or clients of IBP a new somatically integrated experience of themselves, others, and the world through this breath work, and also some body work that I haven't mentioned. Actually have this here to show some of the exercises that are used from time to time. Patients can see the world through a much more constructive and productive lens. And briefly, my role in all of this is that I am a passionate student of IBP. I'm constantly looking to learn more. There are IBP therapists available throughout the Lower Mainland and the world. If you look at IBP institutes online, you can search that. And as a naturopathic doctor, I believe in treating the whole person and try to integrate the principles of integrative body psychotherapy into all my work with patients, whether you present with a physical or emotional primary concern. I believe it's all connected and all part of finding permanent care. Thank you for joining me today, and it's been lovely seeing you guys pop on, and for those of you who didn't catch the full thing, a summary and the video will be posted shortly. Thank you.